Ready? Okay. Hey guys, Dr. Shawn here. With an interesting case. William came in today. Say hey to the crowd there.
Hi.
So he hurt his back pretty bad. He fell off his on like a ladder basically,
or a roof.
A roof.
Yeah.
Landed on his back. Wearing a tool belt on the right side, and since then you haven't been right.
No, hard walking, hard sleeping, hard sitting for a long time.
Okay, and let's stand up and let's just see how you move. Because I always like to show people, like walk towards that way. And one of the first things that I pointed out, and he pointed out, come towards me, is this posture. Posture is the window to your spine. You turn around facing us. So what we did is we took a posture rate, and we found that normally his head should weigh about 11.3 pounds, but it's actually 61.4. A lot of forward head posture. So that can be contributing to it. And the treatments that you're getting any relief at all?
Very little.
Very little. All right, so we did an exam. We found out he's going to be a great candidate for the ring dinger. So you're ready for this, right? You've seen the videos?
Yeah.
That's why you're here. So you're going to be laying on your back. Your butt's going to go here. So lay flat on your back now. So it took you several hours to get here. So it's blown me away with practicing. I've been practicing 27 years. I've been doing the ring dinger since September of 2000. And I've seen people that normally would take 20, 30 visits to get better in 3, 4, 5, 7 visits. So that's what I like about it. So people are coming from near and far, people flying up from North Carolina, people driving in from Pennsylvania. You're about near Albany, so I'm in Manhattan for the viewers out there. Everyone wants to know where I am. I'm in Manhattan, I'm on Broadway and Bleecker. He took a train, and it took you what, 2
miles to walk here.
2 miles to walk, but the train was 2 hours?
3.
4 hours. It's a long trip.
Yeah.
I mean, and you pass a lot of chiropractors on your way over here, you know, and that's just slide down a little bit. You know, you don't relax this to breathe in and let it out. Okay, good. Now, let me have your hands. And then the reason I put these iliac crest pins on are to hold them in place. And this is going to be a really good one. I'm going to pull. And you see what I'm doing? I'm bringing him to 90 degrees. I want you to interlock your fingers together. You're going to keep your teeth together. You're going to breathe in and out only through the nose. And when I tell you to do something, I'm going to have you like wiggle a toe or contract something. Just do that, and this will allow me to distract that. Put your head up for me. Put it down. Okay, good. Yeah, right there. So they took x-rays in the hospital. Nothing was broken. You're still hurting. Okay. Very much. All right. Here we go. Breathe in and let it out. Good. Breathe in again and let it all the way out. Good. Drop this. Wiggle your toes for me. Wiggle. Oh. That hurt. Okay. Breathe.
It hurt too, a little, but then it felt better once
Breathe.
my
Where'd you feel that?
All the way down my spine.
Good. Breathe now. You felt those releases?
Yeah.
And I don't know if the table like kind of jerked. I pulled hard enough that the table jerked. And we have the table bolted down to the floor. So that was a big pull. You're okay now? You got
Yeah.
Okay, good. So now I'm going to adjust the cervical spine. And we have the massive one on the right side. So C3, C4, occiput, 2, 3, drop, sit down. And you felt that from over there, huh?
I just know how much pain he's been in, so it
Good.
can only be
Alright.
better from here.
Good. Reflexes are good. Now stay right there. We're gonna do the rest of these. So what's gonna happen is I want you to just wait till it stops.
Alright.
Then you're gonna turn your whole body facing the window,
Alright.
and then you're gonna slowly push yourself up to a seated position. So turn it facing the window, your whole body. Turn, 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 and then using your elbow and your hand here,
Yeah.
push yourself up to a seated position. Swing your legs off the table.
Off the table.
Yep, and now stand up. And without putting words in your mouth, what's different? What do you notice?
Instant relief. I can always feel that aching pain in my shoulders and my hip, and I don't feel that right now.
Isn't that wild?
That is wild.
Let's do the rest of your spine now. So let's go face down. That's a good sigh. So a good sigh like that helps reset the nervous system. Right. And like I said, this is for, he's a difficult to treat patient. You know, big trauma, been getting treated, seen no results.
It's been 14 months.
It's a long time. So we're gonna drop that left iliac crest. Good. And you landed on the right side.
Yes.
So what I did here is we did a leg lift test. So drop that left leg up, not drop it, lift that left leg up as high as you can. You can see easy, put it down. Now do the right leg.
Little
A
easier.
little bit easier than before. Yeah, so his sacrum, which is this triangle shaped bone right down here.
That's what I've been saying.
You must have whacked that out big time. So I'm gonna kind of drop it in. Now it's gonna be 2, 1, 2, 3. Good. And not holding back on that, right?
No.
Lift that right leg straight up. That looks better. How's that feeling?
It feels a whole lot different.
Okay, good. All right, so I'm gonna adjust this mid-thoracic / transitional area in a minute. Good. 5, 4, 3. Good. Breathe in for me and bend your knees. Bend, 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 bend. That's it. Good. You saw my biomechanics. I had to change that. That was a good side. All right. Good, upper thoracic spine, big time, nothing there. If things don't move, I don't force them. Breathe in, and let your air all the way out, and bend your knees, tough, good. All right, flip over, lay on your back. Whew.
Now we have to run 2.5 miles back.
Good workout. All right, so I'm gonna unload the knee, hip into the lumbar spine, drop it. Drop this talus. Good. A little separation there. Good. That's it.
See, I try to do this at home.
That's why I have a job. Stand up for me. All right. Now, stand up again. All right, turn facing that way. Okay, so with you, I'm going to have you take your hands, open this up really big. Take your head, bring it back. Take your scapula and squeeze these back. And we're going to bring it back into extension and stimulate those nerve endings. So with somebody like you, we do this a couple times to get you back in action. With less downtime. Good. All right, good. Now you can walk around and tell me what's different. Because I know you just did a hell of a lot.
I feel a whole lot different. I feel straighter. I don't feel restricted. I don't feel like anything's trying to pull on anything. There's still a little bit of pain below my shoulders, but not like it was before.
Right, and like I said, this is a one adjustment.
Yeah.
Usually we recommend 5 or 6 visits over the course of 2 weeks, maybe even if somebody could do it within 1 week to 10 days. We'd like to keep the visits close together.
Yeah.
We'll find is the people out there that do this, like Dr. Johnson or Dr. Elia, they eat twice a day, 3 days in a row, 6 visits to really get that body going. But for you, it's kind of hard getting here,
all the way here.
make it all the way here.
We
So
take a trip down for the week if that need be.
that's what people do. And that's why people will fly down to Houston and spend 3 days. But being that we're in Manhattan, you know, so my recommendation is go home, you're gonna be sore.
Yeah.
I want you to ice tonight. Try to get back here next week as early as Monday, again, for another follow-up adjustment.
All right.
We'll go from there. So for the viewers out there, just wanted to document this real interesting case. We'll see you next video.